Do you know what your A1c test is for? Otherwise known as your A1c test. Hi guys, I'm Dr. Don, and we're gonna go over and we're gonna take a few minutes and we're gonna talk about the A1c test, what it's for, who needs it, why we need it, why we use it, what it actually tests, how we use it to determine treatment protocols, and then a few things at the end is how to lower your A1c score and even help get your diabetes under a better control, if not even getting you off of your medications. So first and foremost, H1AC test, otherwise known as your A1c test. Hold on, there's a bunch of hemoglobin tests, a few other things like that. Essentially what it's doing is it's checking the amount of sugar that you have had in your blood system over the last 60 to 90 to 120 days, depending on the time frame of the test. The test usually looks at about 60 to 90 days, but it can go as far back as 120 days. And so what it does is, what happens is your hemoglobin molecule is the part of the red blood cell that actually helps transport oxygen through our system. And the more blood sugar you have in your system, the sugar actually attaches to the hemoglobin molecule. So the test actually measures the amount of bound sugar to the hemoglobin molecule. It's a pretty very useful test, pretty ingenious actually, and it tells us how well your blood sugars have been controlled or how not well your blood sugars have been controlled over the last 90 days. It does this by the bound glucose in your system stays on the red blood cells, and your red blood cells will recycle themselves every 90 to 125 days, or depending on the research, 110, 120, 90, 125. Everybody is a little different. We see different numbers, but essentially it's about every 3 to 4 months. That is why we test your A1c every 90 to 120 days. This is to show us how well controlled your blood sugars have been, as well as how the progress we're making on treatment to do that. It tells us how well, if you're on medications, the medications are doing. It's also a test used to actually diagnose diabetes. Now, I've taken a few minutes before I've even mentioned the term, but yes, what we're doing is we're looking at diabetes, particularly type 2 diabetes. So, and since type 2 diabetes is a process we usually see later in life, but we are now starting to see it more and more in younger people. So what do the test results mean? Because that's a big number. And when we have patients come in the door, we always ask, what was your A1c number, if you remember it? And a lot of people say, well, it's been lowering, or it's 7 something, it's 8 something, it's 6 something, it's 13. So here's what the numbers say. So anything under 5.6%, you are not diabetic. That is, your blood sugars are under 100 when we test them, and they've been under that for the last 90 days. So you are not diabetic. That's where we want to be. Anything between 5.7 and 6.4, that is prediabetes, syndrome X, or metabolic syndrome, just depending on the term you want to look at. It is also when you're coming down from higher levels of diabetes, it's where you're going to come into. And this usually tells us that the medications that you're on are helping control your diabetes, that you are not yet needing medication. The lower the number, the more you are likely to be able to manage your diabetes with nutrition and exercise, proper foods, watching some of the foods that we eat, and the like. So, and then anything over 6.5, you are diabetic. And the scary part is that higher the number, in the 9s and the 10s and the 11s and 14s, the more complications you have that are associated with diabetes, such as peripheral neuropathy, where we lose feeling in our legs, pins and needles, burning sensations in our legs, our feet, our hands. They also will lead to amputations and then complications due to the amputations. You also see increase in heart disease. You have liver and kidney disease, particularly kidney failure. You have retinopathy, which is the losing and the reduction in eyesight, leading to blindness. Those are just a couple of of the conditions. Alzheimer's is another big one that we see. Those that are diabetic or even pre-diabetic. You still have a lot of the same risk factors if you are in the pre-diabetic stage. That's that 5.7 to 6.4% on your A1c test. You still have a lot, if not all of the same risk factors that somebody who is lack of a better term, full-blown or medicated diabetic. So it is absolutely imperative that you work very hard to get your A1c number down, get your blood sugars controlled so that you are no longer a diabetic and no longer needing medication. It reduces all of your risk factors. So here's just a very few simple ways of controlling your diabetes and helping to lower your A1c. First and foremost is to eliminate any easy sugars or quick sugars. A lot of people call them the white sugars, the white carbs, but essentially they are breads, pastas, rices, cereals, candy, soda, diet soda, any products on it that say diet and they've replaced the fat with more sugar. You also have to be able to identify the hidden sugars. So there's lots of hidden sugars in foods that we don't know, because there's 26, 32, they're coming out with new names for sugar every single day that they can label our products with. So we want to always be on the lookout for that. And there'll be another video, we'll talk about those, the sugars down the road. But you always want to be on the lookout. Number two is you want to increase the good healthy fats. So you want to increase fish oil, avocado, coconut oil, olive oil. You want to increase the consumption of those. Those will actually help control your blood sugars. Good healthy fats are a much better source of energy than sugar. So we want to replace our sugars when possible with good healthy fats and as well as proteins. And good healthy proteins such as fish, egg, chicken, all of these preferably organic and free range. And finally, one of the other ones that we see in research, we see this, we've been seeing this now for the last 11, 12, 13 years. There's been more research. Some of it's up in the air and some of the research shows pretty good. But what we see in the office is we supplement with cinnamon. So we add cinnamon, up to 3 grams of cinnamon a day will actually help us control our blood sugars. That's one of the other ways that you can help. So I hope this is very useful for you guys. If you liked it, give us a thumbs up. If you don't, give us a thumbs down. If you have any questions, please leave them in the comments below. Share the video with your friends, your family members that are either diabetic, pre-diabetic, or you are concerned that are diabetic. If you have any questions, please call us, comment below, email us, get a hold of us. We'll help you walk you through the process of not becoming a diabetic anymore. So until next time, guys, see you soon.